One of the questions that we elicited from the internet and our Facebook site is, why are PPIs the gold standard treatment for GERD? And this is really a great question. And it's a complicated one that I'll try and go through quickly. In the 1980s, 70s and 80s, the surgical treatment for GERD was the Nissen fundoplication, as we discussed, but that was done through a foot-long incision in the abdomen. So lots of patients, when they thought about this, said, no thank you, we'll just continue to do home remedies. And there were a whole host of home remedies out there, apple cider vinegar and bicarbonate water and things of this nature, things that actually can even work well today. In the 70s, the drug companies developed a drug called Tagamet, which is rarely seen out there anymore, but in that class of drugs is Zantac and Pepcid. And so those were H2 blockers. They really changed the way we treat a lot of diseases, and GERD was one of them. So it definitely helped with the symptoms of GERD, heartburn. So those did a pretty good job of that. It also really took care of a lot of stomach ulcers and ulcers in the first portion of the small intestine. So those were almost wiped off of the planet, or at least in westernized countries where these drugs were available. Then in the 80s, we began to see the development of proton pump inhibitors. That's the class of drugs that are Nexium, Prilosec, Protonix, Acifex, Dexilant, all those drugs are in that class. And that drug is really, really powerful and almost eliminates acid production in those who are taking it consistently. And so, again, with those drugs, it took away the symptoms, and these seem to be relatively safe, although there were some issues of concerns initially over cancer, and none of them were approved for long-term use by the FDA. But because they are relatively safe, physicians became more and more comfortable with placing patients on these long term. At the same time, but much later in the game, we developed the laparoscopic technique for the Nissen fundoplication. And unfortunately, it became very popular amongst a lot of surgeons very quickly. I say unfortunately because these surgeons weren't necessarily trained in the open treatment, the open operations that we had for heartburn. And again, there can be significant complications and side effects from these operations. And so while we initially saw a big push for these operations, the medical community effectively rejected the Nissen fundoplication because there were significant complications. So they said, you know what? These drugs are pretty safe, why don't you just keep taking them, and your symptoms are better anyway. And so really it became a forgotten disease process almost for a period of 15, 20 years. So what happened in this ensuing 15 to 20 year period is that we found that these drugs are not as benign as we thought. And in fact, currently today we have 20 million Americans who are on these drugs daily. That's huge. In fact, this is a $10 billion business. Well, currently there are no less than 3 FDA warnings with long-term use of PPIs. So the first warning is low magnesium levels. This comes from an absorption issue that we know occurs with these PPIs. So this can cause arrhythmias in the heart and chest pain. I've operated on several people for that reason alone. The second is osteoporosis, and we see that manifested in concerns over long bone fractures, hip fractures, and wrist fractures. And finally is C. difficile colitis, which is a disease that comes from altering the bacteria, the natural microbiome that live in our gut. Normally, certainly PPIs are bad at wiping out some of the good bacteria and leaving some of the bad. So those are 3 FDA warning issues. We know from other studies that there seems to be an increased risk of cardiovascular events. That would be heart attack, stroke, things of this nature. This was published in Circulation not too long ago. These are associated with PPI use. Finally, there's definitely issues with B12 absorption, both on the PPI side and the H2 blocker side, but PPIs are much worse. So people suffering from anemia and low B12 levels, this can be the reason for that. So these are not benign drugs. They were not designed for long-term use. And so what again we find is that out there in the medical community, and partially our fault because maybe the surgical community didn't do their job correctly, 20 years ago, we have folks being on these medications lifelong and really kind of ignoring the disease process. And I'll make one final note, and that is that people are very worried about esophageal cancer. We're going to have a whole segment on esophageal cancer in a second, but these drugs do nothing to prevent progression of disease even onto esophageal cancer.